Hi, everyone. Good evening. Hope you're all having a lovely time. And happy St. Patrick's Day belatedly. Welcome to this chat that we're having this evening, which is hosted by GCN and ACT UP Dublin. And we're going to be talking really to mark the 1-year anniversary since the GMHS, the Gay Men's Health Service, was closed by the pandemic. And we want to discuss what that has meant to the community in the meantime, and what we can do to hopefully get the service back up and running. It's going to be a fairly broad-ranging chat. We have a few people to talk to about different aspects of this whole thing, and we'll have some suggestions of things that you might be able to do to help people get the service reopened again. So we'll get straight on with this, I think. First of all, we're going to be talking to Bill Foley from the Gay Health Network. He's the secretary of the GHN, and we're going to talk to him about, a petition and some other issues around. So please, hiya, Bill Foley.
Hi, Rory. Thanks for...
Hi, Bill. You look very bearish.
Thank you. I'll take that.
Yeah, you should. So, Bill, why don't you set the scene for us here and talk about the GMHS?
Okay. I suppose Gay Health Network is an organisation that provides information around STI prevention and HIV prevention, largely through our information platform man2man.ie. And so we would have been instrumental in talking to the Sexual Health and Crisis Pregnancy Programme way back in March of 2020 in relation to putting out advice to people around risk reduction with COVID and sexual context and so on. So we work very well with the Sexual Health and Crisis Pregnancy Programme on those kind of issues. I suppose looking back to a year ago when we first entered COVID, it was difficult to believe that it would last as long as this. And so advices that we were putting in place at the time, it was difficult to imagine that we would be kind of implicitly advising people to abstain for sex, for instance, for so long, and that the advice would remain the same. But obviously, people's behaviour has adjusted to the longevity of COVID, and I think people are hooking up again and meeting again. It's an important part of our lives, an important part of our mental health and sexual health and physical health in order to be able to have continuing relationships and so on. And so implicitly within that, there is the idea that we need to have a monitoring service for our sexual health throughout this. The idea of closing the sexual health clinic for so long is really untenable. Yeah. And so way back in June, we began discussions with the Sexual Health and Crisis Pregnancy Programme, really to try and reopen that. And we've had meetings with them. We've put our concerns in writing. We issued a statement of concern back in June to highlight both the function of the clinic, which is more than just treatment, it's also about prevention. And there's obviously concern that without those treatment and prevention facilities available to us, that both HIV and STI are likely to continue to rise. So the answer back, I suppose, at the time was really that COVID is the main gig at the moment and health staff are being redeployed. And so as time went on, we continued the letter writing campaign to HSE. In December, around World AIDS Day, we issued another press release, and jointly with Gay Community News, we started a petition to have the service reopened. And that campaign petition is still ongoing in change.org website. I think the connection or link will be part of this broadcast later.
And Bill, can I ask you, what has been the sort of responses to your letters and inquiries and so on?
Well, as I say, that mostly what it is that we will open when COVID is reducing. So following our statement in December around World AIDS Day, I appeared on RTE News, and there seemed to be a response to that in the sense that they made an announcement shortly afterwards that the service would reopen early in the new year. So we took that as being kind of indicating that January would be a reopening time. But of course, post-Christmas, there was a huge surge in COVID and things went back to the back burner again. We have since written to the Minister to offer our concerns again, just directly to him, the Minister for State, Frank Fegan. And I suppose bringing it there is also in recognition of the fact that at this point, what we need is not just a reopening of the service, but a kind of planned reopening in a way that addresses both the needs and the deficits that were there previously. I mean, Cayman's Health Service was a wonderful service, but it was turning away almost as many people as it was serving, really.
Mm-hmm.
And what's needed is a bigger, more streamlined version of the service once it reopens again, not just in Dublin, but throughout the country. We need to have multiple services of this quality and caliber around the place so that people can access both treatment and testing facilities in a very workable capacity. So we're actively pushing the minister now for a meeting to discuss those things, not just a statement of commitment to reopen the clinics, but also to engage with the other issues that we're raising of concern in terms of people affected with ongoing mental health as well as physical health.
Because, I mean, and just to be clear for anybody who stumbled across this discussion, and the GMHS is the Ireland's only, dedicated statutory, sexual health service for gay, bisexual men, men of sex with men, and the trans community.
Yes.
Right? Yeah. And are you asking people still then to continue signing the petition, and where can they find it?
Yes, it's on change.org. It's in a couple of hundreds at the moment, but obviously a lot more signatures will be required. So we'll certainly be looking at kind of pushing the advertising and the links for that over time. But it's still live up there as far as I know, and people can sign it. As I say, I hope that this meeting kind of connects a link to it as well.
Well, we'll be putting up the link to the petition during tonight's discussion. Thanks a million, Bill. Very informative. Good to see you looking so well. And
you
talk
too.
soon.
Thank you. Bye.
And I'll be back in about 10 seconds' time with Andrew Levitt from ACT UP. And there he is indeed. Hello. In a 3/4 profile. How very fancy of you, Andrew. Hi, Andrew Levitt from ACT UP.
Hello, Rory. Nice to see you again. How are you?
I'm good. Happy St. Patrick's Day. So, Andrew, tell us ACT UP's position in all of this.
So our position is like we were really delighted to see the kind of response from the community in the past year, the kind of growing frustration with the delays in getting the clinic back up and running. And as Bill mentioned, there was this kind of unusual, letter from a number of community groups on this, which is really great to see, because it's something that historically not all organizations would have seen sexual health as like a real community issue, administrative thing that gets dealt with somewhere. So it's good to see that kind of response happening. There's also been a lot of activity in the DAL. There have been a lot of parliamentary questions that are coming from I wouldn't say every party, but probably almost every party that actually has a member in the DAL. Renewa has not submitted any questions. But so that's been really great to see. And there have been a number of TDs who I hadn't heard of before, who have been really proactive on this. So that's been really great. But it doesn't seem to be having a huge amount of effect. So I think, from our view, part of the problem is that the GMHS has long kind of suffered from indifference or neglect within the HSE in terms of providing stable funding, providing, approving HSE contracts for employees. They relied on what you call them, agency staff quite a bit in the past, and that's stuff that was beginning to be addressed with some new funding under the National Prep Program that began in, I was going to say last year. Now it's 2019.
Yeah.
That's actually,
time is meaningless nowadays.
Yeah,
so that's
exactly. Fine. Right. Sometime in the before time, this thing happened. So there was a lot of excitement right around the time that obviously COVID hit and things shut down. but so about that, about things that were about to happen and didn't happen, so we see the problem as kind of within the HSE management. There's not the policy is there, the funding is there, things are approved. It's just a matter of the will within the immediate organization that GMHS is sort of lodged in at the moment. So we thought that rather than kind of going indirectly through politicians and petition stuff, just go right to the person who can make the difference, which is the chief officer of Community Healthcare East. That's the name of the organization, also known as CH06. But so we thought that going right to the top of the relevant organization was the way to go. And so this week, we launched a new initiative encouraging members of the public. So her name is Martina Quealy, and she, I believe she's a nurse by training in history. But so she's at the top of this healthcare organization that looks after non-hospital kinds of community healthcare stuff. So we wrote to her in February, explaining kind of our concerns and what we wanted to see, and asking her to really like take use her authority as the chief officer to facilitate the reopening of the clinic and the completion of these projects that would go some way. As Bill mentioned, the clinic was chronically over capacity, turning people away. About 1 in every 8 people who turned up to the clinic were turned away. Or were counted as turned away. That doesn't include the people who turned up and didn't even stick around long enough to get counted, right? So there's a huge problem with that. So it's really, really, really vital that this stuff be really like pursued aggressively. So we're hoping. So we appealed to Ms. Quealy.
And did you get a response yet?
We got a polite response from someone a little further down the line. It was a boilerplate. You were seeing in the kind of parliamentary questions and stuff coming back. So. Not a lot of like no firm timeline, certainly. Okay.
And are ACT UP still encouraging people to write?
Yeah. So we just started that this week, and I don't know if you can see it here. I tried to make a little sign. I'm not good at this media. Thank you, Katie. Yes.
I see. Okay. ActUpDublin.com, open -GMHS now, and the information on who to write to and where to write to is there.
That explains the kind of the basic, like the outlines of the issue and links to some other information. And it's a little tool that will generate a template. It creates an email. Actually, the message, and you can customize it, and it'll export it into your own email program. Okay. So you can customize it as you like, and you can add or take away. But it makes it really easy to do it very quickly. And so we think it's really important to really demonstrate the community interest in this. This is a real priority. This is important to people. If people are among those who've attended the clinic or who would like to attend the clinic, those kind of people are really important for them to hear from. So that's what we're focusing on right now.
And you say like to attend the clinic, because attending the clinic is sort of a rite of passage for a young gay man in Dublin. So I feel sorry for the ones who haven't had that opportunity yet. All right, so everybody, please go to actupdublin.com/open-GMHS-now, and you'll find all the information there, how you get involved in the letter writing campaign. Thank you so much, Andrew. Nice to see you.
Likewise.
Digitally. And we'll be back in another 10 seconds with another member of ACT UP, but this one is an ancient old guy, because he needs to be, because he's going to talk to us about the history of the clinic. Hi, Noel Donlan.
Hey, Rory, how are you?
I'm good. How is the Starship Enterprise?
It's very good. It's just, it's pretty good.
Noel, I described you as old and ancient, but that's not true. You're only around my age.
Exactly.
But you are, you've been around, and you know a lot. So talk to us about the Gay Men's Health Service.
I think just to put it into context and history and where it came from, and of course it came from the previous pandemic. Some of us have been through another one, which was the HIV and AIDS crisis. It was very much born out of that. In the days before the HSE existed, the Eastern Health Board set up ARC, which was the AIDS Resource Centre, which is at Bagot Street Clinic, which was the side of the hospital on Haddington Road. And that was very much focused on sort of for people who injected drugs, really, as a sort of prevention. They would provide methadone and the needle exchange and everything else, but and also HIV testing and prevention. And off the back of that, then they started to do HIV testing for the general public. I think one night a week or something. Yeah. And then off the back of that, in '91, McQuinlan and Dave Wise, who were at the Drugs and AIDS Services, as they were called, they carried out a survey in gay bars and clubs and saunas to use the term at the time, looking at the sexual and the HIV risk behavior of gay men, which is good. And actually, over 480 guys actually did interviews with them and stuff, which was good. So they were able to kind of gauge, what was happening in Ireland, in Dublin at the time. And then off the back of that, the Eastern Health Board established the Gay Men's Health Project in October 1992, which later became GMHS. And even at that time, you probably remember there was a debate about whether they should actually use the word gay. I mean, it was before decriminalization, but it was also, the worry was it would put people off because they'd be queuing outside and they'd be identified as gay or there's a lot of stigma, or people would assume you're, maybe person who injected drugs, like it was mounted.
But then, there was a lot of stigma, and in a way there still is, a lot of stigma around it. But I have a lot of sympathy too, because sometimes people roll their eyes by thinking, people who are worried that other people might think they were gay. But I would say, how long did it take you to be comfortable for it, with it all? Imagine if you were a straight guy who had to go to the clinic, So I have sympathy with them. And of course, nowadays it's not on Bagot Street; it's up on Hastings Street.
No, absolutely, that's right. Yeah, it moved, and when I started to use, I actually used what was ARC, and then it became Gay Men's Health Project and whatever. I wound up living down the road from it, so a friend suggested I go there, and I did, and then I used it for a few years, moved to London. But when I came back in sort of 2015 or whenever I came back, but in 2017, once the PrEP clinics set up, I started going back there again. And Siobhan O'D was managing at the time, and Adam Shanley is a very good friend of mine, was there and stuff. So it was like a whole other world, really. It was you were able to go in the main door of the hospital. You were kind of restricted, although the plaster was falling off the walls and stuff still. But then, the move then, which Siobhan looked after, moved to the Meath primary care, and things were starting to go really well. And and then Siobhan made sure it wasn't just about HIV testing and STIs. There's also vaccinations, and I got to even get my flu jab there, and it was starting to become a lot more than it was. And then obviously that all stopped.
I think it's super necessary to have a standalone thing that's unafraid, simply for the fact that it's one of my little bugbears. I go to the HIV clinic at James's, and they're amazing. The staff are wonderful and all that stuff, but it still to this day feels very hidden, and as if they're embarrassed of it around the back of the hospital.
Oh, absolutely.
I mean, Angela Lansbury to bloody well find it,
Yeah,
and over
we
years,
always sit down by the bins. It literally is
totally,
where the bins
it is. And over the years, all the buildings around it have become these fancy, glass and steel, fancy business. And recently they built a new one right up beside it. Where do they still say the geriatric, whatever the new term is, or the geriatric building sort of? And I always feel like even the old folk are stealing our light, it does feel that. So I've always liked that about GMHS, that it's just unapologetically a service
absolutely
to the queers.
Absolutely, and certainly when Siobhan was managing, she's left now, but she was trying to make it more about that, and a community like I know several people who've picked up several guys at the clinic as well. It became more of a social thing. And in ACT UP, like we used to do outreach all the time. We were just blatant about it, about, when you couldn't get PrEP officially through here. Like, we'd be out about talking to people and stuff. So it became quite a useful sort of space. We still have a lot of friends from GMHS moments.
Well, it definitely has played an outsized role sort of in the sexual health of the community over the last 20 years. So to see it closed up for a whole year seems like a tragedy to me.
Yeah. I mean, and again, like, because I would get my my prep there, I actually wound up switching back to the guide, who are also not taking bloods at the moment. But it's like the whole thing was just a mess. So I just said, I'll just switch back to guide until GMHS finally opens, properly and fully and so on.
Okay. Well, here's hoping the good work that ACT UP are doing will lead to a result in this. Thanks, Noel. Always good to chat to another owl codger.
That's it.
Thanks, Noel. I'll say goodbye to you, and I'll be back in 10 seconds to talk to John Gilmore Kavanagh. Hello, John Gilmore Kavanagh. I do love a hyphenation. I love a hyphenation. I'm good. How are you? I'm good.
Okay, thank you.
And now, John, of course, you are a member of ACT UP, but you're also as an assistant professor of nursing. So you're going to sort of look at it from that perspective for us.
Yeah, so I suppose like one of the things that people kind of often ask is around the need for the gay men's health service, for a special service for gay, bi men and trans community. And I suppose it's not to take away from the fabulous work that's done right across the arena of sexual health in Ireland. And I saw a comment earlier around, we absolutely need more investment in sexual health in Ireland, right across the board. And there were some great people providing really culturally competent, really important support. But there is a need for a specialist service. And part of that need is because of the particular health inequalities and disparities gay, bi men and the trans community face, which are definitely in the realm of sexual health, but also much broader than that. I think what GMHS provided for us was a go-to space, a space where gay, bi men and the trans community could go and meet a nurse or a doctor who don't just perform swabs and bloods and all of these things. They're there and they provide an assessment and provide a space for people to talk about whatever health issues they have. And if they're not doing that, they're not doing a very good job at their role. And the staff at the GMHS are wonderful at that. I think one of the really important things to note from an Irish context is still the last EU Fundamental Rights Agency LGBTI survey found that 1 in 4 gay men in Ireland aren't out to any healthcare practitioner. They've never told any healthcare practitioner that they're gay. A quarter. That goes up to about 36% for trans people, and 40% of bi men are not out to any healthcare practitioner. So when you think about, getting a symptomatic STI or even just wanting a screen, how you coordinate that with a healthcare practitioner that you're not out to. The GMHS it says it on the 10. You're not going to experience homophobia and transphobia here. So that's really, really important.
Yeah.
And I suppose it's that there's a whole area of a need for us to understand gay men's health better and trans health better. So we talk about the disparities in sexual transmitted infections or in HIV. There's a lot that we don't know as well because we haven't asked the question. We haven't had those conversations around sex and sexuality, and we're starting to have them more, and it's really important. But I think just having that place, because actually a lot of us are still, I work in healthcare as well as in university, and people still experience homophobia and transphobia. We don't have figures here, but like in the UK, Stonewall did a really important survey of LGBT Britain and looking at the health issues there. You're still seeing 1 in 4 people experiencing homophobia or transphobia in healthcare settings. And they found that 1 in 7 people in the UK in their survey avoided getting the healthcare they need for fear of discrimination. So having that place to go, even though services are limited, and Bill referred to the fact that the GMHS was turning away as many people as it was seeing.
Yeah,
we don't need to be closing this service. We need to be expanding it. We need to be looking at how we provide psychological intervention, how we provide intervention and support for people who are, having issues with their substance use, how we are providing primary care services in a place where gay, bi men and the trans community are going to go. You know, and then being able to signpost them off. And I talk to lots of my friends working in sexual health, and that's what they do a lot. You know, someone comes in for a screen, you get chatting, you realize there's something else you want support with, and you provide that link for them in healthcare.
Yeah.
I think is disjointed when we don't have the GMHS.
Yeah. Well, I think too, because you know, there is so much sort of stigma wrapped up in STIs and all of that anyway. And then when you throw in the gay stuff too, I mean, I'm a 52-year-old, you know, super gay who's been HIV positive for 25 years or something, and I still occasionally get icky a bit about it when I'm talking to my consultant of 25 years. You know, it's just a a natural part of things. So if I was 20 or 19 or something, and you know, still a little bit unsure of myself, you know.
Yeah, my own PhD research, you know, highlighted that, you know, the unshockability of those practitioners in services like the GMHS was a real draw. You know, going there, they've heard it all before, and they'll provide you with a bit of a laugh, and you know, and that's what I'm saying. And lots of the former staff at GMHS work in lots of other services around the country, and it's great to see them there, and they're improving those services. But we still need I keep saying our clinic. This is our clinic as a community, and we need to be quite clear. And it shouldn't be the HSE providing a service for us. They should be facilitating our service. And I think that's really important for us to kind of, once we get the doors open again, to kind of look at how that's provided as well.
I mean, do you see the remit of the clinic changing in the future?
I think a broadening out of service would be really welcome. And I know, you know, someone mentioned Siobhan earlier. I know, you know, previously there were lots of plans afoot for development of the service. And I think that's what's absolutely needed. You know, we need to look at kind of psychological support. We need to look at primary care support. We need to look at, you know, just engaging people. Bill talked about the importance around health promotion. Knowing that somewhere you can get information. Because, you know, websites are great and apps are great and all that's great, but sometimes you need to have a chat with a healthcare practitioner, because it's not as simple as ticking the box. It's a more complex situation. And I think there's a real place for the GMHS going forward to develop more with the community. Yeah.
I mean, even those things, you know, when I go into the doctor, I'm always annoyed at myself if I haven't written down my little questions beforehand, because they always go out of my head. I never remember them. So there's absolutely no digital replacement for a warm human being, doctor or nurse, probing you a little bit about, you know, things to get, you know, to draw out of you what the heck is wrong with you.
Absolutely. That's why these people are there. You know, while self-management is really important around sexual health, and we really want to empower people to take charge of their own sexual health, sometimes things go wrong or there's questions, and it's really important you have a, you know, culturally competent and broadly competent healthcare practitioner there to support you in that.
I mean, is that something that the clinic has sort of developed over time? The ability to work with different sections of the community, whether they are trans or, you know, immigrant or.
Yeah, I think Noah and Diego will talk a little bit about this later, but absolutely, it's that learning. And I think that real partnership approach that was embodied within the staff. It wasn't necessarily about the structures around. Sometimes the structures aren't the most helpful thing, but it's really important to have those structures so we can have the staff. Andrew talked about that, you know, agency staff, you know, that's not a way to run a service, you know, having people on precarious contracts. We need to have people who are there, who we know, who are part of our community, who we can engage with, and who are invested in our health as well. I think that's really important. The GMHS is invested in the health and well-being of gay, bi men and the trans community, and we need to continue to support them and have them support us.
Yes. And in return, we are invested in the survival of the clinic. So once again, I'm going to remind everybody to please go to the ACT UP site to get all the information, and please write off an email to Lorraine, is it? I forgot her name. Martina. I'm sure is a lovely woman. I'm sure she's a lovely, inspiring woman. Yes.
We want to work with these people. We really want to work with these people.
Good. All right. Thank you so much. And I'm loving your look tonight. You equals you. Undetectables equals untransmittable. Google that, folks. If you don't know, yes, lovely to see you. And best nursing to you.
Thanks, Rory.
And we'll be back in 10 more seconds with Noah Halpin. Mhm. Hi, Noah.
Hi, how are you doing?
I'm good. I'm just having a quick glance at the comments. Just so everybody knows, if you leave a comment on Facebook or YouTube or wherever you're watching this, we get to see them here. People sort of, well, yes, the usual, expanding the service outside of Dublin. Of course, that would be fantastic to see. We will come to some more with the comments. If you have any big questions or comments, please add them in there and we'll try and get to them later. Hi, Noah.
Hello, I'm loving your lockdown hair.
Yeah, well, fresh back from Poland with a Polish haircut, a necessary journey, and fresh out of your COVID bed.
I know it's been a rough couple of weeks, but sure, look, we're back on the up.
Yeah.
So
Yes, well, you look well on it. So talk to me, Noah, about the clinic. Well, I should point out there's me lazily assuming everybody knows you, Noah. I'm sure most of the people watching do, but for the uninitiated, Noah is a service user because you're a PrEP user and you're a great advocate for PrEP. And many of us have bumped into you in various nightclubs and bars in the before times, running around educating us. And of course, you're a member of the trans community. So from those perspectives, talk to us about the clinic.
yeah, so it's important to note that, for trans people especially, I'm sure, a lot of the community would know that trans healthcare in Ireland is in such a dire strait that, we're often discriminated in nearly every single section of healthcare in this country. So, for trans people, especially when accessing any sort of healthcare service, a lot of us will already have our backs up. A lot of people, we see doctors, we see nurses who don't know about our bodies, who don't know about our treatments, who don't know anything about us really. And we often find that we have to be our own doctors and we have to explain things. But, with the GMHS, my first time there in Bagot Street, I've walked that clinic and the staff of that clinic, and especially Siobhan, the former manager, go on a journey with the trans community in terms of providing sexual health care to us, and it was through their willingness to learn and to adapt to, trans patients and listen to us. It was kind of the one clinic I knew that once I walked into for a PrEP appointment, for a screening appointment, that I wasn't going to have to fight the nurse. I wasn't going to have to explain everything to the doctor because, they came on that journey with us and they learned from us. I knew that it wouldn't be assumed how I had sex. It wouldn't be assumed what genitals I had, and that they'd be knowledgeable about how I need to take PrEP. Because for people who don't know, some trans people have to take PrEP differently to, say, cis men have to, and all to do with the absorption rates and different tissues and how you have sex and things like that. And I found prior to going to the GMHS, other clinics didn't know that, doctors didn't know that, which can be, a terrible mistake if you're given incorrect information. But it is the only specialized sexual health service for trans people.
Well, I have to admit, I have always assumed how you've had sex. I've just always assumed you have great sex, chicken. But now I will unassume that and have momentary sadness for you. So you're, as a trans user of the service, your experience has always been super positive?
Yeah, I mean, from the first time I went, like I said, I've seen them come on a journey with the trans community. So, and I see, especially since they had moved premises, I was about to say last year as well, as if time is just suspended somewhere. But, they adapted very quickly. Now, of course, the Gay Men's Health Service, it was named quite some time ago. It is open to non-binary people, trans-masculine people, trans-feminine people. But even just when they moved that service, they implemented just these nice touches, these things that could make the trans community feel that little bit more comfortable. They adopted their language on all of their literature and their website to say, the services for gay and bisexual men, other men who have sex with men, and the trans community. Prior to that, we were never really included in that literature. Then, you know, you turn up at the building for the first time after they moved, and there's just this massive rainbow flag, and underneath it, a trans flag outside the building, painted on permanently onto the wall. You know, so even with just that move, and then we saw, you know, all the staff were super educated on trans identities and trans bodies. You know, there wasn't an assumption that, you know, I wasn't going to be given the standard swabs a cisgender person would be. I'd be asked. And that's so important, because healthcare professionals don't learn about trans identities and trans bodies and transsexual health unless they ask us. And so many other healthcare professionals don't. So I've seen that the staff, especially, like, I don't have to go in there and explain everything. I'm handed the amount of swabs I need. I'm advised how to take prep the way I'm supposed to. And that makes such a difference. And that makes the trans community trust their healthcare professionals. And that is such an important thing, that trans people trust their healthcare providers, because it's very, very rare.
And just in case anybody is listening, I mean, it's kind of pointless information at the moment, but it moved to, it used to be on Bagot Street, and that's sort of where it famously was for so long. And these days it's up on Heytesbury Street at the primary care centre up there in what used to be the, I'm having a blank, whatever hospital. I was up there on Heytesbury Street, the Meath Hospital, on Heytesbury Street there, Dublin 8, I guess it is it? Or is it Dublin 8? I think that's the name, yeah. Great, well, thanks, Noah. And I'm not sure if you're going to hang on there or whether you're going to be blipped off for a bit, but we're going to also be joined here now by Diego Cacheta, who's going to talk about the service from the, well, mostly from the point of view of immigrant communities. Hi, Diego. I see. No, you are going to stay.
Correct.
Hi, Diego. How are you?
I'm very good. How are you?
I'm good. I'm enjoying talking to everyone this evening. So, Diego, talk to us about the clinic from the perspective of you know, immigrant communities and so on.
Mm-hmm. Well, I worked in the GMHS since 2012 up to last year when they closed. And I think one of the main reasons I was invited to work there was to be able to support Brazilians or people that speak Spanish. And I think that was like the main reason that they invited me to be working there, because through all the years that I was there, I could notice that Brazilians were the second nation going to the clinic the most. Like, firstly would be Irish, of course, but then after that would be Brazilians, and lots of students that just arrived in Ireland and maybe with not a good command of the English. So the importance of, for them, not just as a queer, but also coming to a new culture, to navigate the health system, it can be very stressful and traumatic. So for them to have a space that they were comfortable to go, knowing that if they don't understand what the doctors or what the nurses are saying, they could call me and I could go to the consultation with them. This is very powerful for them. So when you think, sometimes when you go because you're worrying about something, maybe you're not feeling well, and then on top of that, you have to add the stress of the language barrier.
And especially when it's medical conversations and there's a whole other vocabulary and I have to say, here's the other thing. One of the most shocking moments for me in this sort of area ever was about 10 years ago, when the Brazilian population here was much smaller. Being at a nightclub, it was one of those funny after hours ones, and a Brazilian trans woman coming up to me on the dance floor because someone had told her that I was living with HIV, asking me if I could give her, you know, some antiretrovirals. And I was just so shocked that the distance between her and accessing services was so huge that she thought the best option was to go up to a stranger on the edge of a dance floor to ask. Like, I was kind of mind blown by that.
I think that's like the nature. I would call that an outreach work with a volunteer outreach work. And I think in that sense, I could bring like the fact that the Empower program.
Yes, because you work with Empower, right? And explain that.
I am one of the outreach workers. So we never stop working. Like, even when the lockdown happened, we're still working online. and we have our phones on. We kept trying to support who was in need, especially the most vulnerable ones, in terms of like, because one thing of the program that we work with is with male sex workers. And when everywhere was closed and they needed to go to a service, so to have the Empower program that they could go back and say like, can you please assist me with this? And being able to do that through like a very limited service, because then everywhere was closed, but then gradually they kept opening, like James and then the Mater, and especially in St. Vincent Hospital, they've been doing an amazing job, like supporting all the referrals we send to them. And like I have a big thank to give to Dr. Cajo, Siobhan, Laura, and Clarence. And so to have this link now with the Empower program, with the clinic.
Just for the benefit of people who don't know, explain Empower.
So the Empower is a program run through the HIV Island. So we do outreach work, which we are online, and we answer questions in relation to sexual health, and we also help linking people to services if they need to. And also there is a HIV rapid test that is still on as well. Every Wednesday and Saturdays, you can go online on the website, the Empower website or HIV Island, and book your appointment. And we are there every Wednesday and Saturday.
And Noah, talk to me about the PrEP and the importance of the clinic there.
Yeah, so, you know, with PrEP, we obviously got the free PrEP program brought into Ireland in, was it November 2019, which was a really important move for us. That made PrEP accessible. You know, we didn't have to pay for PrEP any longer. But of course, the PrEP program's never going to quite work like it should do unless we have capacity in clinics to really benefit from the PrEP program. And I think, you know, myself and Diego were there the very last day of the last PrEP clinic at the GMHS, and there was like this buzz about, and there was this excitement because, you know, a second PrEP clinic was going to open at the GMHS. And I think, was it the following week, Diego, or 2 weeks later?
No, they say
it was going to open very soon after.
Yeah,
and we were there, and I remember going in and I gave Diego a hug and I said hello to Siobhan. I remember all the talk about the second PrEP clinic, and, you know, being involved in ACT UP, and that's something that, you know, we'd always wanted as well. It was just really, really exciting knowing that the service was going to expand that little bit more. It was going to be able to help that little bit more. They were already to capacity in their PrEP clinic. So, you know, the importance there. And then it was devastating when that evening, the GMHS closed its doors and it hasn't opened in a year. And that means not only did we lose the potential to increase capacity for PrEP, but through the time that it has been closed, people have not been able to stay on PrEP because they couldn't access clinics. They didn't understand, you know, how the swap over to the guide went, especially, you know, people who had emigrated to the country might not have English as their first language, didn't quite understand the swap over, and no one was there to explain. So, you know, it was so important. And I remember that last day, that last clinic day, and it just happened to be my clinic day, and the excitement around the second clinic, and then to have the doors closed the following day was devastating.
And so, Diego, talk to me about, you know, the initiatives that, you know, you're working on in recent years.
So now at the moment we have the outreach program that we are doing, and we also, as I said, we still doing the HIV rapid test every Wednesday and Saturdays. If you guys want, you can go there. And it's really hard to try to envision something at the moment because COVID is so, you never know, things are changing every day. But we are trying to bring like home testing, which we did last year, and was like a massive number of people accessing that. So it's something that the Adam are looking to keep going with it, and because at least it's something that people can still using, and then through that, if there is something that we can support them in relation to linking with other service. That's something that we are there to do.
Mm-hmm. And have you noticed the impact of the closure?
Yeah, huge impact, because online, people, they talk freely because they're behind the screen, so it's way easier to chat with people. And so there is STIs still happen, people still having condom-less sex, needing PEP. And if you think how impactful is to have a GMHS open, because if you're non-European and you need PEP, and if the clinics are closed, you have to go to A&E. But if you go to A&E as a non-EU citizen, you have to pay over 300 euro for the A&E fee. So if you think a migrant, a student here in Ireland, with this massive house crisis that we are all living at the moment, and with COVID, that probably lots of them lost their income, and having to go to A&E and pay a 300 euro fee to access that, which it's free and should be given in all the sexual health clinics, which are when they are open. Wow,
I didn't realize that. God, yeah, I mean, 300 euro to a foreign student or whatever. God, that's hard. Look, we are going to take a short break of a minute or two, and then we're going to come back with everybody and sort of wrap this up with a sort of a broader discussion. And if anybody wants to ask any questions, leave a comment under the YouTube, Facebook, whatever, and we'll see those there. So we'll be back in a couple of minutes. Hi, we're back. God, we make a pretty picture, all of us. Thanks all for joining us. I'm having a gin and tonic. It is my one and only joy in life every day now. I have my one gin and tonic to get me through another day in lockdown. Talk to me generally about the impact of the closure of the clinic, because I think it's important to impress on people and what we've lost and why we're asking them to take action to change that. Andrew, do you want to?
Well, we've lost. We've lost 12,000 in 2019. They had 12,000, almost 12,000 clinic visits. Some would be the same person coming back more than once, but so 12,000 appointments just gone, right? And there's no, gone with the system basically stumbling along. The remaining things like barely able to function at that point. So there's just people can't get tested in particular, and obviously the main focus is on people who have symptoms or have maybe been contacted by someone who's been diagnosed with an STI. But that's only a fraction of the total number of people who get STIs, right? Like STIs, the majority are asymptomatic. So the only way to detect them and treat them and prevent them from continuing to circulate in the community is to have asymptomatic screening. And right now that doesn't really exist, other than for maybe the people who are in PrEP services. If those services are able to do testing, which at the moment many aren't. So there's a huge problem in terms. We don't even have a sense of the scale of what's happening with STIs. Well,
ironically,
right.
Ironically, our problems are similar to the problems with them stamping out COVID, testing asymptomatic people and getting people on treatment. John, tell us more about that from as the one person here with a medical qualification.
I'm not. Diego's a nurse.
Oh no, sorry, I take that back. Yeah, I see that.
But absolutely. I think testing is a core part, and I think as well. I was looking at the HIV Ireland tweeted today the numbers of new HIV cases, and obviously monosex with men and gay bi men are particularly represented in those numbers. And the narrative is often, the lack of responsibility on our part, and we're not good enough with the way we have sex. And it's, gay men, bi men, and the trans community do test. They get regular testing with asymptomatic testing, and are very conscious of, because sex is important. Tom Strong said in the chat there, sex is essential for us in many ways. And we are a very responsible group around ensuring our sex lives are healthy and we keep well, because it's really important. And the health service is taking that away from us. And there's a huge demand. There was a pilot launch of a wonderful thing, home testing, absolutely fantastic. And the HSE, the Sexual Health and Pregnancy Program, did a pilot of some home STI testing. 24 hours. All of the tests were gone for that period. And that was just from 3 counties in Ireland. And so there's huge demand out there. That they weren't just for gay, bi men and the trans community, but I'm sure a lot of people who access them were from those communities. Yeah. We need, at that point, we need to invest in our services, and that's absolutely key right across the country as well. And the GMHS, while it's based in Dublin, has always seen gay, bi men, monosex men, and trans people from right across the country. People travel miles, take a day off work to come, and we absolutely need to look at expanding these services, not shutting the doors and saying, blaming COVID.
Noah, and from the trans community's perspective, have you noticed an impact?
Yeah, sure. Like I was saying earlier on, a lot of trans people are very comfortable going to the GMHS purely because of their cultural competency and their competency when it surrounds, trans bodies and trans-specific sexual health. And, I did ask, did a Twitter poll not long ago about, trans people, or asking trans people if they've, that are still sexually active, if they had been going to get tested. And there was a huge flip. I do this every year, this survey. And there was a huge difference between, maybe I think I did it in January of last year to this year, that people just weren't going to get screened. And these people were also people who were still sexually active. So, what Andrew was saying and what John was saying there is, the current situation in Dublin anyway, is that there's no PrEP clinics in Dublin are taking new clients at the moment, not one. So nobody, if you are not already on PrEP, you cannot access it in Dublin at the moment. The second point is there's no asymptomatic screenings going on in any sexual health clinic in Dublin at the moment. And like Andrew said, a lot of STIs are unsymptomatic or asymptomatic. And then the third point, that if you are symptomatic, there's now a wait to see sexual health services because their clinic days have dropped. A lot of their staff have been redeployed to do vaccination clinics and things like that. So, you know, if you ring and say, I have a symptom, you might be told, we can't see you for 2 weeks, and you're living with that symptom, whatever it may be, for those number of days or weeks. So at the moment, the only people who are being screened are current PrEP clients in current clinics that are open. But only Vincent's are seeing people in person. So all the other PrEP clinics are doing virtual. So it means really the only people getting screened in Dublin are PrEP clients of Vincent's. That's it.
Well, I mean, even on a personal anecdotal evidence, I've noticed how packed the clinics are, because when I was last at my own HIV clinic, and I wanted to change the day because something had come up, and they said I wouldn't be able to get in for another 3 months.
And that's crazy. And when you look at the John was saying the statistics of this quarter of the year that were released today, they're not too far off what they were this time last year, most of them. And when you consider that very, very little testing has been done, that's obviously not the true number of where they're sitting at. They're obviously sitting higher than that because there's been such less testing. So it will worry me now to see when or if clinics start opening to capacity again, what the actual impact is going to be.
Okay. Let's have a quick final word from people. Bill, what do you want people to know? Can you hear us there, Bill?
Well, I think the main thing is really, yes. The main thing is really the point that Noah and Diego have been making earlier on in relation to access to prevention services. You know, this year we've seen something like 61 new HIV diagnoses in Ireland in the first 10 weeks of this year, and that compares to about 131 for last year in this period. But as Noah has outlined, we don't affect by the lack of testing. That in other jurisdictions where testing and treatment is available, the effect on new HIV infection rates is drastically reduced. So in Ireland, we're at an increasing mode in Ireland, unfortunately, where the figures are growing year on year, and they won't reduce until clinics like the Men's Health Service are back up and running again. I think as part of our demands collectively, we should be adding for us to put in a clinical lead in the infectious diseases nationally. For a lot of
Sorry,
time.
Bill, we've lost
I
you
think
there.
without that post being within the broad health services that's advocating for us.
Okay.
And
I
finally,
managed to work it out there, Bill. We've lost you there a bit, but we were able to understand essentially what you were saying, thank God. Diego, what would you like people to know?
I think what I would like people to know is the point that Andrew and John was saying in relation to people going testing without having symptoms. And I think one thing the GMHS managed to do really well was to create this culture and break the stigma. So people were going to the clinic to test as a routine test, not because they were fearing they have an infection. Yeah. So I think not having that and having that stopped for now, it's huge, especially when it comes to sexual health, which it is a taboo still.
Yeah.
And yeah.
And Noel, as a long-term service user, because you're a randio gay.
That's it. Yeah. I've been trying for years, but anyway, maybe I'm doing it wrong or right. I'm glad you mentioned your experience, because it's very important to realize that, you know, in GMHS as well, it's not just all about HIV negative people as well. I know friends of mine who are living with HIV who would go there for STI services and other things as well. So it's very important. And when I mentioned earlier our previous pandemic, that's not over either. There's still a lot of work to be done in HIV and unfortunately AIDS related death still exists around the world globally, and so it's not over yet. But hopefully, the hope is that off the back of these experiences, that plans that were already in place and budgeted for and sort of ready to go, that they're implemented as soon as possible, and that things get up and running. That's the ideal thing, I think.
Well, let's hope so. And John, would you like to have a last word before I go to Andrew?
Just send the email, use the email tool, and keep up the pressure to open GMHS now and expand, and let's keep demanding more services. Let's keep demanding respect for our sex lives, and sex is a human right.
Yeah, it certainly is a human right. So Andrew, give us your last call to action. What are you asking people watching now to do, and how do they do it?
So we are asking people in the community who would like to see the GMHS opened and like to see the HSE really kind of change its attitude towards the clinic and really see it as a valuable asset and a real priority for, as people are saying, further development. We're asking them to go to our website, which the link is there, and send an email to Martina Quealy, the Chief Officer of Community Healthcare East, which is responsible for managing the GMHS. So she is the person in the organization that most directly, has the authority and the ability to see that the clinic is reopened as quickly as possible. So just the link.
Yeah, the link is down there. Don't worry. Yeah. And I'm just having a quick glance down at the comments and some of the questions. I see Rob O'Brien. Is anyone aware of the PrEP clinic at the Mater Hospital? I was lucky to be able to get seen there. Yes. So, I mean, that suggests that Rob was a new PrEP patient.
This is so that's a PrEP clinic that David Field is kind of running, and guess where he used to work?
Like at GMHS.
Exactly.
Like all the good people.
Employee. But but anyway, he's doing an amazing job. He's really fantastic. I'm lucky to be in there as well myself. So.
And I see someone has mentioned your houseplants, Diego, and says Shante.
You bring Brazil here.
Well, okay. Well, I think everyone should have the message now. So please go to the link there. Please write the emails. Please encourage your local representatives to ask more questions to get the clinic back open, because it's an essential service that we need and has been, I'm absolutely confident saying, has saved actually many lives over the years. So let's get it back open. Diego, your houseplants have been very popular on YouTube and Facebook, and the rest of you have been less popular, but still liked. And
I'll settle for that.
Good. I guess I'll leave it there. I'm going to finish this and say good night to you.
Good night, everyone.
Good night, all. Act up.
Bye back.